Hi, I'm Frank Diamond, the managing editor of Infection Control Today, where we're helping those on the front lines of infection control and prevention fight COVID-19. Joining me today is Michael Millenson, an internationally known healthcare expert whose focus is the quality and safety of medical care. He's going to talk to us today about the place of infection preventionists in healthcare and whether it's going to change even after we defeat COVID-19 and things get back to normal, hopefully sooner rather than later. So what do you think about that, Mr. Millenson?
I think whether things are going to change after we get back to normal, as you said, sooner rather than later, as everybody's hope, Frank, is really a key question. Infection control experts are extraordinarily important to patient safety and to patient health, and pretty well invisible to the general public, and the role not really being seen as important. So actually, I'm really hopeful that those of us who care deeply about infection control on an everyday basis can use this crisis to have something really important happen after the crisis is over.
Do you think they're also invisible in some ways to other healthcare providers? I mean, now the rock stars, the infection preventionists, but when the crisis passed, it seems that the attention on them seems to pass as well.
I think you're absolutely right, Frank. I have my wife's sister is an infectious disease doc, and even the infectious disease physicians, much less the nurses and others, complain about being pretty low on the totem pole and not really having folks pay attention. It's really kind of interesting. In some ways, perhaps because infection control seems quote unquote common sense or simple or something. Don't we know how to do that already? That perhaps we don't acknowledge what a poor job we do often of actually implementing what we know how to do. And I think that's really, to me anyway, one of the most frustrating things is that we have interventions we know how to do. We know they're important. You see all the time the World Health Organization and the CDC talk about how important hand hygiene is, and we're not implementing them. And perhaps this crisis will highlight pretty starkly how important implementation of infection control really is.
Hand hygiene, you mentioned. Hand hygiene has been a constant problem for decades. And you would think, as you mentioned, that it'd be common sense.
Ignaz Semmelweis discovered the fact that hand hygiene was important to infections around 1847, and he ended up in an insane asylum after trying to push this. So that's the progress we've made. When you insist on infection control, they no longer put you in an insane asylum. So we've solved that problem. There we go. Now, to get to actually wash your hands, that's a little tougher. There's two issues. The most important issue is we don't measure it, right? So people think they're doing it and they're not actually doing it. And then the second is there's no standards. So the Joint Commission and the Medicare program do not require you to show that people wash their hands 80% of the time, 90% of the time, whatever number you might choose. They merely require you to have a program to improve hand washing. So if you go from 15% to 16% to 17%, but of course you can even stall at 20% as long as you have that program in place. So both the people who are not washing their hands don't see that they're not doing it. They don't see the consequences, and we don't hold anybody to standards to force them to see it. It's really kind of frustrating. The other thing, which is frankly embarrassing from an ethical point of view, is when you look at the numbers for transmission of infections from patients to providers, such as HIV, which is a very serious infection, although it's now a little bit more controllable, you see that providers take hand hygiene prevention measures very seriously, infection control very seriously. And the CDC numbers show that providers getting infections from patients with HIV has dropped almost nothing. On the other hand, providers giving infections to patients continues to be a problem. And that's kind of ethically embarrassing. When we, the providers, are harmed, we make sure it doesn't happen. But when the patients are harmed, because we don't see it in the same way, we don't take the same precautions, that's very troubling. It is really inconceivable in some ways from a common sense point of view that one, the CDC doesn't even know what the hand washing rate is nationally. They haven't monitored it for at least 15 years. And two, that they just sort of use under 50%, and that's not a crisis. I assure you, if there was a hand washing rate of under 50% that was causing nurses and physicians to get sick or die, and we could say that's why the hand washing rate would go up. It's just people care, but they don't see the consequences, and it's troubling. Where this might change things permanently is people being able to see themselves in the situation of somebody getting an infection, right? And I've been thinking about this a fair amount, right? So with COVID-19, even in hospitals which are not seriously affected by it yet, people can see that look what happens to folks who are getting serious infections. They can see the consequences in front of them for patients, and they can see the consequences in front of them for providers, right? People like me, doctors, nurses, EMTs, just regular people in the hospital are getting infections and they're being seriously ill and they're dying. And I think that makes infection top of the mind as we come out of this. Having said that, it's really important to build on that momentum. It's really important for infection control professionals to build on that feeling of all of us are in this together, all of us are affected, all of us want to see this change, and use that sense of social solidarity to get out of the obscurity that unfortunately too often they're in, and become top of mind priority for administrators, for chief medical officers, for folks like that. At least that's my hope, that there, but for the grace of God go I, is a feeling that persists long enough for us to do some of the changes that are long overdue. We're in a crisis now. And so infection control is absolutely the top of everybody's mind. On the other hand, it is not hard to think that when this crisis is over, the chief financial officer and the chief medical officer come in and say, you know what, we gave up elective surgeries for all these months. We've lost a huge amount of money. The most important thing we need to do is, get our orthopedists back operating, get workflow going, get, all sorts of things. And by the way, before this crisis, our infection control was fine anyway. Right? So nobody was worried about it before the crisis. We'll go back to where we were. So I think it's going to be important for infection control professionals to show that things weren't so great beforehand, and to show that the kind of things that we were doing during this crisis are to the economic and clinical and frankly ethical benefit of the hospital. So there's an opportunity not to lose your seat at the table, because if we don't take this opportunity, we know that things are going to go back to not only what they were, but we got to get some revenue here to generate, and turn on those hip and knee replacements, and let's get in a little bit of cosmetic surgery and get this place moving again.
Do you see the CDC stepping up its efforts as far as not just hand hygiene, but infection control in general after this is all over, and how that might affect infection preventionists or hospital administrators?
No, I don't. I mean, it's possible that the CDC will get religion. They have not measured the hand hygiene rate since 1982. They put out patient safety kinds of things and say, ask your clinician or staff person to make sure they wash their hands, as opposed to trying to get people to do it as the CDC talking directly to providers. So I think that after this, they're going to be dealing with a lot of political consequences of poor performance, frankly, in COVID-19, and trying to do anything on hand hygiene is not going to be anywhere on their agenda. I'd be happy to be surprised, but the politics of it aren't there. So this is going to happen at the grassroots. It is possible, and I've written a column with Leah Binder of the Leapfrog Group saying that the Medicare program should put in hand washing standards. So you have to reach 80, 90%. If the government does something after this, then I think, from CMS, I think that'll be possible. But CDC, I don't see doing it. The Joint Commission is dependent on the fees that hospitals pay. They are a paper tiger. In 2016, they put in a standard saying if during a surveyor sees you not washing your hands, you get an automatic demerit, and celebrated this as some incredible achievement when it came 16 years after they first required a hand hygiene program. So the Joint Commission is a paper tiger. The CDC doesn't really care all that much, except, in its official pronouncements, it officially cares. If we're going to have any sort of kick in the rear that's going to cause the situation to change, it's going to have to either come from public pressure or from the Medicare program. I mean, there's a lot of room for debate over accountability, and you do not want to be punitive. So I think you're absolutely right there. At the same time, if you never set a goal of 100%, if you never try to really drill down as to the reasons why, as we've seen with CLABSIs, right? CLABSIs, people thought, look, you can only get down to a certain rate and then you can't get any further. And then we showed with the Michigan hospital experiment that in fact you could get down to close to zero for sustainable periods of time, not always sustainable. And frankly, that was around in the, I guess maybe 10 years ago now, and it still hasn't been implemented, right? We still don't say, look, if we showed we could prevent an infection, why don't we do it? Remember, these are not expensive interventions, right? These are not interventions that require a lot of money. What they do require is a lot of management time and commitment, okay? Right. And so the question I ask when I give talks is, explain to me your justification for not first do no harm, right? Explain to me why building a new atrium is more important than putting into place processes that will prevent often life-threatening infections like CLABSI. Look at infection control as something that we can take our time, and we should give everybody a pat on the head that they did it. And look, they've gone from 40% hand washing to 60% hand washing. It's a 50% increase, and it's this ghetto removed from common sense and what the average person would say. And if you went, there's a saying in journalism, tell it to mom, right? Put things in simple language. If you went to your mother and you said, you know what, doctors and nurses in our hospital are supposed to wash their hands all the time, but we've been about 40% for 10, 15 years, but within a year we went to 60% and we gave everybody a party. She'd go, wait, 60% is okay, right? It just defies common sense and ethics for us to treat infection control as something where slow improvement is okay. And I'm sorry, I'm a bit of a militant on this. The hospitals that are not doing this are not all safety net hospitals that can't afford it. They're not people who are living hand to mouth. They're people who are building beautiful new buildings with gorgeous skylights and going around the country to recruit surgeons, and they're not giving the money and the management attention they should to infection control. And I feel sometimes like a voice in the wilderness saying this, but again, it's tell it to mom, common sense. How can you allow an infection to happen that you could prevent? Not super expensive. How can you allow people who trust you, who care for you, to be harmed? I would say to infection control professionals, that when things go back to normal, they won't automatically change. How can you, as infection control professionals throughout all the ranks, physicians and others, how can you not waste this crisis? And I understand we're in the middle of it, and that's not something that often people who are working as hard as these folks are can think about. But I would say that as we emerge, it's very important for infection control professionals to think, how do we take this crisis and use it as a lever to cause the change that we care about so much?
Michael Millenson, thank you so much for being with us today.
A pleasure, Frank. Thanks so much for having me.